In this video, I'll be talking about the major differences between government medical colleges and private medical colleges. I won't be telling you which one is better or which one is not good, but I'll be giving you the insights into how these institutions are different and what you can expect out of them if you're choosing to go to a government medical college or a private medical college. Both are very good and help you become a good doctor, except the exposure you get and the atmosphere you're in and the various activities you would be exposed to are slightly different. So I'll be covering all of that in this video. First of all, the most important thing is the financial aspect. So government medical colleges are usually less expensive. Their whole fee for the whole MBBS course would be somewhere under 50,000 rupees or under 1 lakh per se. In most of the places would be under 1 lakh. So, but that's not the case in private medical colleges, where the fees can extend up to around 20 to 25 lakhs per year. So it's very expensive, and a lot of money is involved in this. So both of them you need to clear, need to get in, so there's no difference in that, but the fees is different, and you I'll explain why the fees are different in the following point. So the second most important thing is the patient load. So generally in a government setup, they do free treatment, so they don't charge for their treatment. So there are going to be a huge crowd of patients which you will be exposed to. On a daily basis, you'll be seeing about 100, 200 cases if you go attend a clinical posting. You won't be seeing all the cases, but around 200 to 300 patients will come per department. So it's very high patient load you can see in your government medical college. Whereas in private medical colleges, you won't have much exposure with patients, and usually very few patients arrive to these um, private medical colleges. There are exceptions on both sides of government and medical private, but generally government medical college patient load is very high, and private medical college the patient load is little bit less. So you should know that the more patients you are exposed to, the more variety of the symptoms and signs you can actually look at and get familiarized with, and see how doctors handle all these caseloads, and you'll be exposed to a lot of problems faced in these government hospitals usually. So and there's more focus on practical cases, and there's more focus on theoretical knowledge. I'll tell you, I'll highlight this a little more in detail. So usually the doctors who are going to teach you medicine in a government medical college, they're not paid a very large amount for teaching you. Their whole salary is based on the work they do as a doctor in serving people. Teaching you is there like secondary or very less priority job which they do if they have the passion for that. And some people are very passionate, they teach in extreme detail, and it's you need to be considered, you are very lucky if you get one of those professors. So but on the private side, they are paid huge packages for just taking classes, so it's their job to only take class, and that is their highest priority. So they'll focus a lot on theory, and for every subject there will be some person who's paid a hefty amount just to teach that subject. So that's why there's the difference between practical cases and theoretical knowledge. So that's where there are split, and you need to choose which one do you prefer. So next, lesser sophistication in campus. This would include the hostel facilities, the various library facilities, and other amenities which may or may not be present in a government medical college. But all of those are present in private medical college. The hostels are usually better. They have gyms. They have other amenities like local transport within the college, and they have gyms, they might have swimming pools, they have a lot of stuff going for them. That's because they charge so much. Okay, so you can't you're getting what you pay for. So they are a little more sophisticated with their lifestyle. And moving on to the next point, graduates feel very less pressure and they tend to become lazy. Like the process of getting into a government medical college is much more strenuous compared to getting into private medical college, where you need to pay a lot. So in a government medical college, you need to be best of the best to get in. So once you get in, few people are like, okay, I worked so hard, I've got into medical college. Now what? Let me just chill for a few years. And this chilling period is where you need to actually work the most and learn everything about medicine. But unfortunately they become lazy because there's no one to like put pressure on them and make sure they still do well except their parents and themselves. So no one is going to put pressure on themselves, and they are not going to like force themselves to be exceedingly good and brilliant and all. But that's not the case in the uh, private colleges, because you pay a hefty amount and it becomes an instant burden on you that you need to get value for what you pay for. And so you start putting ultimate pressure on you to do extremely well in your assignments and in your exams and whatever your professors, everything you take it to a whole new level, because you're paying around 24 lakh to 5 lakhs per year. So you're spending around 1 crore, so you want to get some kind of value out of it. And that uh, that itself is an extra burden on all these graduates from private medical colleges. So about the college lifestyle, usually in government colleges there's a lot of events going on, and hostels mixed together. So there's a lot of chance you'll build a good relationship with your juniors, your seniors, your professors, all of them. But that's not the case with private medical colleges. You may get exposed to few of them and you may talk to them, you may build contacts and acquaintances, but you will never truly be like a good friend, or you won't have a very deep connection or relationship which will extend for a long time. But that's you'll get all of those in government medical colleges. And a most important thing I would like to highlight here is in government medical colleges, people from different backgrounds come, like a farmer's son, a businessman's son, a washerman's son, a painter's son. Like the choice are just infinite. Okay, basically anyone who works hard and puts in their effort gets in. That's how a government medical colleges work. So you will find a wide variety of backgrounds of these graduates who are studying there. But usually in private medical college, the people who come there are well off. They are well. They're ready to spend a little bit. But there are people who take loans and come into these medical colleges as well. So basically, people can afford to pay so much. They have a different set of lifestyle. They live differently. But you can see most of how the world works in a government medical college, because you'll have a wide variety of students over there. And then finally, the biggest disadvantage, this is the biggest disadvantage and not the only disadvantage of government and private. So the biggest disadvantage is you have a high chance of becoming lazy. No one will be there to put pressure on you. You get 50 percentage, or you get honors and you get university medals. No one is going to care about you. No one is going to force you to do well. So that's the biggest disadvantage with government colleges. If you think you're self motivated and you can do really amazing stuff on your own, please consider getting into a government medical college. But the biggest disadvantage of private medical colleges, there is too much financial burden, which may lead to unethical practice of graduates. Like you pay about 1 crore for 5 years of your peak uh, age, which is between your 20 and 25. You'll come out as a graduate, and as soon as you come out, you will see all your engineering counterparts and your arts counterparts earning about uh, say 50,000 per month, but you would be starting off with around 30, and that would be really frustrating. So you go into starting to earn in different ways, and usually that ends up with unethical practice. I'm just saying usually, and it's normal for that to happen because you put in a lot of money. So that's how that works. But there are exceptions, and there are really good doctors who want to serve coming out of private medical college background. So that would be the a small like insight into a government medical college and a private medical college. So that would be about this video. Thank you. Please like, comment, subscribe, and share these videos as much as possible.